let's talk about heart health. You may want to keep your heart healthy so that in your 70s, you're still able to have fun with your grandchildren, throw a football in your backyard. According to a statistic figure in UN, the estimated cost of chronic disease is expected to reach $47 trillion worldwide by 2030, a major battle we are facing. And the number one risk factor for disease and death in the world is high blood pressure. It accounts for about 20% of all deaths worldwide. Approximately 30% of adults and 30 to 79 worldwide suffer from hypertension, and the incidence of hypertension among middle-aged and elderly people aged from 50 to 70 worldwide is about 49%. Hypertension is a risk factor for a variety of disease, including stroke, dementia, and cardiovascular disease. About 53% of the deaths from ischemic heart disease, about 53% of stroke death, and about 62% of chronic kidney disease death are caused by hypertension. So why is high blood pressure so fatal? What causes the blood pressure to go up then? There are a few reasons, but one of the major reasons is because the blood vessel becomes narrower. If the same amount of blood goes through the narrower area in the same amount of time, it naturally causes higher pressure. So what caused the blood pressure narrow then? The answer is cholesterol. For your reference, cholesterol looks like this. It is a lipid sterol found in cell membranes of all animal cells and being transported through the blood. And it is an essential part of our body. Without it, we simply die, as it is an important part forming our cell membranes. Not only that, it is a building block to make vitamin D and a lot of your hormones like sex hormones. It's great, right? But why does it bear an evil name and cause our blood vessel to become narrow? For that, let's dive in further. Have a close look at your cholesterol test results next time. It normally breaks down to total cholesterol, HDL, and LDL. You may have been told that LDL is a bad cholesterol and HDL is a good one. But actually, LDL and HDL are not cholesterol. They are cholesterol transporters carrying the actual cholesterol. LDL transports cholesterol synthesized in the liver to the cell. When the LDL first come into our blood vessel, they are fresh and healthy. They're just floating in our blood and eventually hooked up with our liver, because the liver can recognize them and bring them back and recycle the cholesterol out of the blood vessel back to our system. Hooray! Right? Then why, when we examine the blocked artery, it is still the LDL that does damage? This is the key. Healthy and fresh LDL does not become the rubbish. Only when the LDL becomes damaged or oxidized. Damage, oxidized is the same thing actually. It then becomes the rubbish. You may ask, what causes the LDL becoming oxidized? There are a few factors, but one of the major ones come from the diet. In general, if people eat a lot of refined carbohydrates, including sugar, like a beloved soft drinks, chocolate, or deep fried foods like KFC, the oxidation process will start and plaque will be formed. As the amount of LDL in the bloodstream increases and the rate which it is transported to each cell slows, it becomes more susceptible to oxidation by free radicals. This oxidized LDL carries cholesterol and penetrates the intima of blood vessels. Oxidized LDL becomes food for macrophages, which then die, and leaving cholesterol in the intima of blood vessel. The build-up of leftover cholesterol leads to the plaque formation on the intima, a major cause for narrowing blood vessels. When the plaque ruptures, it can obstruct blood vessels or induce clot formation in major diseases and death. This narrowing leads to elevated blood pressure, a significant factor contributing to hypertension. HDL is the only metabolic pathway that removes excess cholesterol from the intima. In other words, LDL carries cholesterol made from the liver to the cell, and HDL carries cholesterol from intima or inside the blood vessel to the liver. Some studies have shown that high HDL cholesterol can reduce the risk of hypertension by 34% and 19% respectively for men and women. Myocardial infarction and angina are called coronary artery disease. Increasing HDL cholesterol level by just 1 milligram per DL can reduce the risk of coronary artery disease by 2 to 3%. And cardiovascular mortality is reduced by 4%. An increase in HDL cholesterol levels of 39 milligram DL reduced the total relative risk of stroke by 18%. HDL was called as a good cholesterol because it helps prevent cardiovascular disease, and HDL should be called smart cholesterol. Studies have shown that high levels of HDL cholesterol in middle age can significantly lower the risk of mild cognitive impairment and dementia. If the middle age cholesterol is 69 milligram per DL or higher, the incidence of mild cognitive impairment in old age can be reduced by 53%. And when the middle age cholesterol is 50 or higher, the incidence of dementia in old age decreases by 63%. So if you want to lower your blood pressure and keep your blood vessel healthy, you need to increase your HDL and decrease LDL.